Hello, everyone. Thank you so much for being here with Edge on Regenerative Medicine Show. I'm excited. Today, I have Dr. O'Keefe. We are going to be speaking on a few things today. And first, before we do that, if you want to get more information on Dr. O'Keefe, you can go to restoringhealth.center. And I believe that she's located, hopefully I'll say this correctly because I'm not from there, but Altamonte Springs, Florida.
Close. Altamont Springs. Very close. It's in Orlando. It's the Orlando area.
Yeah. Anywho, so today we're going to be talking about IV nutritional therapy. This is something that I've been seeing a lot on the internet, and I know that a lot of people have questions. It seems it's been around for a while, but to me and other people, it seems like layman people, it seems like it's very new, and I wanted to kind of talk about it today. And how does IV nutritional therapy actually help out? From what I've heard, if you don't have a lot of energy or if you struggle with COVID, this is a really good thing to get for your body. Is that correct?
Yeah. Well, if you think about most issues, well, we have to go back to our diet, okay, to start, because, most of us don't eat the nutrients. Our bodies don't get the nutrients they need, right? So one of the big complaints I get, people come in, I'm fatigued. Now, what can cause fatigue? Well, a million things. All right, so we have to go down those rabbit holes and figure that out, but let's say your immune system is depressed, it's tired, it's fatigued, it's this. Well, what do you need? Well, you need vitamins, you need minerals, right? So we can give you high dose vitamin C, that's going to help pop up your immune system. The B vitamin is going to help you with some energy. Minerals are going to help you sleep, they're going to help you with muscle cramps, things along that line. So, depending on what you have going on, we could use nutritional IVs, conditions, Epstein-Barr, another reason why people come in with, oh my God, I'm fatigued. It always makes me sad when I have because I'm getting older, right? So
we all are right behind you.
I know. Like I was saying, aging is not for the faint of heart. No. But I'll get these. I call them kids, right? They're 30 years old, 35 years old. They come in as a new functional medicine patient, and they are just so exhausted that they can't hardly live their life. And I'm like, there's something wrong with that, right? So of course, I go looking at a lot of different areas.
Right.
And I'll usually find infection or something in the gut or something along that line. But, oftentimes I'll find something like Epstein-Barr has been reactivated. And that is the virus that causes mono, right? So most of us have been, I think, 99% of us will test positive for having been exposed to it at some point in our life. We've all been exposed to it. But our immune system, for the most part, can keep it subdued unless it gets too weak, at which case it can reactivate. And when it reactivates, you're going to have a very similar situation. You're going to be fatigued. That's one of the things that COVID did, is it reactivates Epstein-Barr. That was my experience with it. So when I have someone who's post-COVID, I always run labs to see, okay, what do we have to fix? Kind of a thing. And part of the way I fix it is with high dose vitamin C, because Epstein-Barr doesn't like high dose vitamin C. And frankly, you just can't take enough of it orally, because you'll never overdose on vitamin C, okay? Because your body has this reaction. If you take too much in, it's going to come out and you are going to spend a lot of time in the bathroom.
Let's talk about the vitamin C, if you don't mind.
Sure.
I think that a lot of people, when they hear vitamin C, they're like, okay, great, I'm going to go to the store and go get some vitamin C. I think we also got to be careful of the type of vitamin C and where we're getting it from. Wouldn't you agree?
Oh, yeah. All supplements are not created equal. There's no question. And there's a lot of really good companies out there. I use several of them. The generic stuff that you're going to pick up here and there, there may be some good ones. It's hard to say. You got to do your homework. You really have to do your homework.
I used to buy it from Costco. And
Oh.
I started doing a lot more research,
Mhm.
and I realized that there's only a strand if you're lucky in
Yeah.
there, and
Yeah.
you got to have an entire bottle to actually have an
Mhm.
actual pill full of vitamin
Uh-huh.
C.
Yeah.
So,
Yeah.
and I'm sure the type of vitamin C that you use, that's why it's good for the IV, because it actually
Oh,
goes right
yeah.
into the system,
Oh,
gets
exactly.
to
It
the
gets
root of the problem.
right. And because it doesn't have to go through your whole digestive system
Mhm.
to come out. So anything that has to go through your digestive system, it's going to be a little weaker, right? Because it's got to go through that whole thing. So you absorb it. And, whereas when you do a nutritional IV, it just goes right into the system. And therefore you get, a really big bump, in your immune,
How long does it
response.
stay into the system if we
Oh
do an
gosh,
IV?
I usually have my patients come in like once every other week that I'm treating,
It's actually really good, because if
on
you do
it.
the
Yeah.
vitamins, you're gonna,
Yeah.
once you pee, I hear, once you pee it, you
It's
pee it
water
out.
soluble. Yeah,
Yeah,
it's a water soluble vitamin,
but
so that's why you have to continue. So the patients that I'm dealing with, we want to get a big bolus of vitamin C,
mhm.
into them so that it can go do its job. And then, we support that with, physician grade supplements, in their protocol. Let's say we're dealing with somebody with Epstein-Barr, vitamin
Right.
C is always going to be a part of it, right?
Right.
Let's say you have a cold. Oh my gosh, go get a nutritional IV. Go give your body some ammunition, if you will, to fight the bug,
Are you
kind of a
seeing a
thing.
lot of people come in since, after COVID and stuff like that, because of brain
Yeah.
fog and it's not going away?
Oh my God. Yeah. And I still have some patients that come in and they still haven't gotten their sense of smell or taste back, and that's a brain issue, right? That's not a
Okay.
problem with your mouth or your nose. That's a brain issue.
Okay.
And so what I do with that, I'm very passionate about that whole situation. I had COVID back in August when we got that big surge, and as I was healing, I was like, I am a little bit of a nerd. I actually made a spreadsheet, of like, okay, I'm taking this and this is what's going on. And these are my vitals. And I mean, and my husband was so funny. He goes, what are you doing? He goes, you're doing a spreadsheet? I go, yeah. He goes, he's an accountant. And he goes, send it to me. So I sent it
I
to
love
him.
it.
And he's like, oh my God, you're really busy in there. I'm like, yeah, I am. I'm not just laying here. I'm working on getting better. And
I love it.
so, I totally squirreled on that, but I became very passionate about the mechanism of action of what's going on with COVID, because we're getting so many patients coming in with long haulers, and I was like, okay, what can we do? What's the mechanism of action? I'm always trying to figure out the cause behind something. How do we got to fix down here so the symptom goes away? And so realizing that was a brain issue, realizing that could be a mitochondrial issue with the fatigue. It tends to reactivate if you've got like a Hashimoto's thyroid, tends to reactivate Epstein-Barr.
Mhm.
So you really have to work with supporting the immune system, balancing out its response. And then what do I do with my patients? I go, well, okay, what do you have? You've got fatigue, brain fog. I'm going to do a combination of nutritional IVs. I'm also going to do something called UV blood therapy. And that is an amazing treatment that it just punches infections in the.
So do you try to bring, so this is the UV, that's the ultraviolet blood therapy, is that correct?
Mm-hmm. Yeah. So that is such an amazing technique. What we do is we take a little bit of blood, mm-hmm, and we put it into a bag of saline, and we run that underneath UV light.
Wow.
And there's a special little, it's called a cuvette or cuvette, I'm not sure how you pronounce it, but it kind of rotates the blood vessels, so the red blood cells and the white blood cells, they all get to see the light. And as they see the light, they absorb the energy from the UV light. Then we put that back into your body. One big fell swoop. It takes about 30 minutes for the whole thing. So what happens is now, for example, your red blood cells are really oxygenated. So now that your red blood cells can get past your blood-brain barrier. So it gets into the brain. Your brain needs oxygen. If you don't have oxygen, you're not working well, right? And it gets in there and it can help heal the brain. It also helps detoxification.
Mhm.
I think I was mentioned to you earlier, I had a situation where I had a bunch of toxins that had gotten around my eyes and into my eyes just from we had built a house, and the contractor had blown a bunch of chemical type of things into the house with the air conditioner running. So I was having issues with my eyes. Every time I get UV blood therapy, I stand up and I'm like, wow, man, I can see so clear, and I know it's a detox issue for me.
Wow.
So when I have patients who have mold, mycotoxins, that's toxic, right? I have them do UV blood therapy, and it's amazing how much faster, they improve. So that's the white blood cell part, or the red blood cell part, but the white blood cell part, that's your immune system. And so the UV light just supercharges your white blood cells. And so we see, infection come down dramatically because you basically just gave your immune system some good guns, so
Wow.
it's exciting. I mean, we had one patient who had Hashimoto's thyroid, and she could not take any medication, couldn't even take supplements. And her, thyroid markers, her TSH in particular, was very high. And so she did a series of the UVI therapy, and she showed us her blood work. She goes, I've done nothing different but that, and it almost completely normalized all her thyroid markers, and she's feeling great. I mean, I've had patients who come in with shingles. We had this one gal come in with shingles in her eye that was so awful.
Whoa.
And within a few, and that's always dangerous too, because you could lose your vision. So I think she only had about 3 sessions, and it cleared up beautifully.
So do you bring these two together and try to use them?
Yeah, I do. I don't do them on the same day because they do different things.
Right.
So I might do, the vitamin C, B, minerals, whatever, one day, and then another day we would do the UV therapy, but, I mean, again, when we go back to COVID, it's like, what do we deal with? We're dealing with fatigue. So I'm trying to help with that. We know that it gets past the blood-brain barrier. So when your blood-brain barrier is disrupted, that's kind of dangerous, because if you go in and you start Googling blood-brain barrier disruption and whatever disease, right? Alzheimer's, you're going to find a connection. MS, you're going to find a connection, and the list can go on and on. So keeping our brain healthy and keeping that blood-brain barrier tight is incredibly important. And, these are just some of the ways that we can help reestablish, the security, so to speak, in our brain.
How long does it start to take, or the average? I know everyone's different.
Oh,
to start seeing results.
Most people, when they do UV blood therapy, they'll notice something after that first session. It's that fast. I have one patient. We're co-treating. He's a cancer patient, has pancreatic cancer, and after his first session, and I'm not saying just do this. You need to be working with working with your oncologist, but he after his first one, he felt so good that he went home and like tiled his backsplash in his kitchen,
Wow.
And it was like, and recently he has he's done a 5K. This gentleman was supposed to not be with us in 3 months, and it's been 15 or 16 months now.
Whoa.
And the blood supply to the tumor is shrinking, and they are absolutely now going to be able to do surgery. So, I mean, this is where you just see wonderful miracles, and it's just such a lovely honor to be able to work with, other doctors and helping patients, that
I bet his doctor is like, what's going on?
Oh yeah. In fact,
I know that for a fact.
Yeah. In fact, this gentleman got COVID and got over it, boom, just no issues at all. And his doctor was like, I don't understand how that's possible. It's got to be the fact that you've been doing this UV blood therapy. And it's like, yeah, it is, I'm not going to say it's a panacea, because I don't think there is any one thing that fixes everything. But I'll tell you, there's very little that I don't think it could help, to be honest with you. It's just been a gift to our practice to be able to offer that to our patients, for sure.
Wow. What would you say that I want to kind of go back to IV nutritional therapy. What would you say, What have you seen it work with, and what does it not work with? Because I know there's a lot of things on the internet that people will say, well, it works for this, but it's not actually proven, or what you've seen at least.
Okay, so
pros and cons, what it does and what it doesn't.
Yeah, the answers are always going to be it depends. Like,
or what you've seen.
What are you trying to get out of it, right?
Right.
If you're saying, oh my God, I am fatigued and I want to go get an IV and that's going to fix it. Well, it'll fix it if the cause is low B vitamins, right? Mm-hmm. But what happens if the cause is mitochondrial have as in the case, again, I keep pointing back to COVID just because I find it interesting. But right. One of the things that happens in COVID patients is that high viral load, your mitochondria is the part of your cell that makes energy, mm-hmm. right? If you're not making energy, you're tired. That's just the way it is. If you're not making enough energy. And what happens with a really, really big viral load is it pushes the mitochondria into like a dormant state, and they just kind of like shut down the factory. So if that's the cause of your fatigue and you go in and you're looking for vitamin C and vitamin B, you're probably not going to see the benefit of it because it's not addressing the problem, right? So I would be supporting the mitochondria, right. with different nutrients and things along that line. If it's, if you feel like you're catching a cold and you need all day long come on. For just general health, it's fantastic. I mean, I get patients who are, and I recommend this to patients who are cancer survivors. Most patients who are cancer survivors realize that they tend to have a higher risk of developing another cancer later on, and part of that is because there are these little stem cells in there. Right. Well, high dose vitamin C on a regular basis, I think would be extremely prudent because vitamin C is known to be toxic to cancer cells. You couple that with oxygen therapy. Cancer doesn't like oxygen either, so getting oxygen, to your body, the UV blood therapy does that, taking oxygen, doing breathing exercises. There's a whole host of things that wow. you can do, it just depends. So it's really hard for me to go pros, cons. It's fantastic for everybody who needs nutrients, period.
And that's pretty much right. everybody.
That's pretty much everybody because our food has been destroyed, right? Yeah. So, I mean, even if we eat organic, the ground has been so deplete of the minerals that they should have because, we're supposed to let the fields rest. I think, what is it, once every 7 years or something like that?
We don't do that.
We don't do that. No, why would we do that?
We got to make that money, man. Come on.
Right. So, so even if we're eating organic, it's really hard to get enough nutrients in that you need. So, for good health, for immune support, for, if you're coming into any kind of cold situation, we do some other things. We do some injections, that help clear fat from the liver. Now, that's a really interesting technique because a lot of folks who have trouble losing weight will find that their liver is clogged. So So one of the things we do, with patients who are, wanting to try to lose weight is we will do their an injection of, it's got 3 different things in it, and it kind of helps clear the liver. Or if I have patients who have non-alcoholic fatty liver disease, absolutely, so and that's all part of the nutritional. We call it nutritional IV, but we also do injections, nutritional injections. None of it is medication. It's all just nutrient based and kind of a thing.
To help heal the body instead of patching.
Right. So again, go after what the cause is. What's causing the symptom, and if we can fix that, then we're, like I just found out something interesting. I was listening to a webinar. Like some folks come in, they have trouble with, I know you're laughing, me listen to a webinar ever all day long. Yeah. And I was reminded of this. There are patients who have a really hard time losing weight. They're eating healthy. They're doing whatever it is that, they're exercising. They could have a mold infestation. They could have, if they've got mycotoxins in their body, or they have varying toxins in their body, they're
Mhm.
toxic. What does the body do with toxins? Right now, let's think about, we have over 85,000 chemicals in our environment right now. Okay, we live in a toxic soup. Our food is sprayed. Meat is injected with steroids and hormones and antibiotics.
Then we have inflammation.
Right, right. So what does the body do when it gets a hold of a toxin? Right, it's like, well, can't give it to the muscle. I'm going to really simplify this, right? Can't give it to a muscle, can't put it on an organ. What do we do with it? Oh, I know. Well, first of all, let's try sending it to the poor liver. Okay. Let's see what the liver does with it, and it's like, well, where does it go? Okay. Especially if you have somebody who is constipated. Now they can't go. So where do all these toxins go? Right. Well, we're going to put it in our storage, right? Our storage is fat. And the body is so smart that it knows, I can't let that stuff out. Don't let go of that fat, because if we let go of that fat, guess what's coming out with it? All these toxins. Then what do? We'll die, right? So it's like, save the unit. So you've really got to, again, even with weight loss patients, it's always, what's the cause? Are you dealing with a toxic overload that we have to address first? In which case, UBI all day long, that's going to be part of it. So it really depends on what comes in as to where I put them, kind of a thing.
Is this something that, let's say I come in with brain fog or low energy, whatever it may be, because they're all kind of connected. Would you say, let's say after 90 days, I'm rocking and rolling, I'm doing good, I'm loving this. Should I still be doing IV and ultraviolet, maybe like once a month or once every month and a half, or how?
Yeah, you could.
Almost like an oil change. Like there should be a checkup.
Yeah. I mean, I do an IV once a month. Okay. Kind of a thing. The UBI, I think it just depends on where your immune system is, and do you still need support? If you've resolved the toxins, you've got energy, you feel good, you're sleeping good, you're eating healthy, everything's fine.
Now it's just autopilot, keeping it maintained.
Yeah. Come in once every 5-6 weeks, get an IV. It's always good for you. If you have a history of cancer, I would strongly recommend.
Well, what if you have cancer? Can you still take this, or? No?
Oh yeah. I have several patients that we're working with right now with their doctors, and it has helped them tremendously. Does it cure it? I don't think so, but does it help with it? I mean, I'm seeing miracles, so I'm like, this is very cool. This is very cool. That is so awesome. And we're giving people quality of life back. And, I mean, it's fun. It's just fun to be able to help people. I mean, I've got this gal, and she's a wonderful patient, and it's something called a neural zoomer. Because she's had a list of things going on, and I thought, and one of her main issues was just, she's way younger than me, memory issues and focus and attention and concentration and brain fog, and she can't sleep at night. Like I think she was sleeping 2 hours a night, something along that line. And so we went through a few things. I ran this neural zoomer, and I was like, well, we're seeing a really big disruption in the blood-brain barrier and some concerning indications, and I said, well, let's work on getting the blood-brain barrier restored, right? Let's work on getting you to sleep. So neurofeedback all day long. Obviously this poor gal was dealing with anxiety and depression. And, so the first thing we did is we were doing the UBI therapy. We were doing neurofeedback with her, obviously working with her diet. And we're like, now she's sleeping, and this isn't all that long. I think we've been working with for a little over a month. Wow. She's sleeping 7.5 hours a night now. And she's like, my nurse practitioner was like, oh my God, she's remembering things that she wouldn't have remembered before. And I'm like, this is amazing. This is awesome. Like there's really nothing better than to be able to help people regain and then maintain their health, in a way that's natural. I get a lot of patients come in, and I usually ask my functional medicine patient, the new ones, what do you know about functional medicine? And they're like, well, it's like a healthier way of dealing with it.
I love that.
And I'm like, well, yes and no,
No.
because you could take a condition, right? Let's go, high cholesterol, right? You could take it if you're concerned about it. You could take that condition. I like to use it as an example just because a lot of people understand it. And wow, well, let's see. I can take a statin, right, for high cholesterol, or I'm going to go over to a functional medicine doctor and I'm going to get fish oil and maybe niacin and this, right? So we're going to just kind of flip one for the other. But see, that's not functional medicine. What functional medicine is, why do you have high cholesterol?
Come on. Yeah.
Okay. So it's like, all right, so what are some reasons you could have high cholesterol? All right. Well, you could be a postmenopausal female. Okay. And a lot of folks don't realize that the first ingredient, if you will, for hormone, any hormone, is cholesterol, right? So when your hormones drop, as they do when you're postmenopause, your body's like, what happened to the estrogen? Where
Exactly.
did she go? Right? So the body goes, oh, I know, we must need more ingredients, right? So we're going to make some more cholesterol. So that becomes, so then you just really want to see, okay, is this a healthy level? Is this normal for this person? What are the lipid sizes and particles and so forth, right? So that could be one reason. So you want to maybe address the hormone situation. You could have a massive bacterial infection, right? A lot of folks don't realize cholesterol actually likes to gobble up bacteria. So check the gut, do a stool analysis, see what's going on there. So the question is for functional medicine, not just flipping for, instead of medication supplements, it's functional medicine is why, so what's going on and what do you need to fix that? And then that kind of balances.
Wow. It's funny whenever people ask me, by the way, I love your analogies. You explain it like the way I like to be explained, third grade. Hey, it's fun. Hey, I love, hey, you know what, people, it's just better for everybody,
Right.
But whenever I talk with people about it, I go, well, let's think of it this way. If you go to a regular doctor, most of the time, only 99.9% of the time, when you go to a regular doctor, I don't want to say regular doctor, conventional doctor that works for the system, we'll say.
Okay.
I'll use that. I'm trying to utilize good terms. So I got to realize I can say it because I'm not a doctor. So this is perfect. So what I've seen is this conventional term, you have this big umbrella, everybody's kind of told what to do. This is the protocol, and there's nothing wrong with that. It's keeping everybody on the same page. I love it. But the problem is that a lot of these doctors are being told what to do, and then they're passing it on to you, even though they know certain things that they're passing on to will not work.
Well,
I just struggle with that.
They have what's called a standard of care. Well, we all do. They have what's called a standard of care. And therefore, for example, if somebody comes in, we'll go back to cholesterol just for consistency. If somebody comes in with high cholesterol, the standard of care is to put them on a medication to lower the cholesterol, right?
Right. But then it affects other things.
It affects the downstream.
And that's what I've seen in, I call it the system, the system where I've had doctors tell me recently, with certain, like with my eyes and certain stuff. And they're like, well, if we give you this now, okay, this is going to affect your heart and your liver. And I'm like, I'm not going to take it.
Why would you take that?
So it's like, can you give me something that's not going to patch it, put a Band-Aid over it? Because I notice a lot of the conventional doctors in the system, they're putting a Band-Aid on it instead of saying, I'm going to give this to you because this is going to help you and it's going to heal you. What I've noticed with like regenerative medicine doctors, what I've noticed in working in that profession with other doctors is that they focus for the cure. How can we help you do normal life without it affecting other ailments in your body and getting you going on? We have prescription drugs kills more. If we knew how many people die every year from prescription drugs.
About 250,000 a year in this country.
So
who would fly that airline? If that was an airline, hey, we do pretty good, but we only lose about 250,000 patients a year or people a year. It's like, ooh.
I know.
And a lot of those are medications too that were prescribed for the correct, but I think some of it is just the mentality,
well, it's because the insurance covers it. See, the insurance covers it. I've seen people where, they're like, well, they're going to cut my leg off, and then they go see a someone that's in regenerative medicine, then all of a sudden, they're doing something simple as maybe do a little bit of PRP or do a stem cell. And next, they don't have to cut the leg off.
Right.
I'm just saying, like,
right. Yeah.
So
there's a lot in the world that can be done, and it's just a matter of, I guess, I don't want to say to me, it's not thinking outside the box. To me, it makes perfect sense. If I've got somebody who has, Epstein-Barr, they have a big infection, for me to give them nutritional IVs, to give them supplements, to put them on a diet, to support their immune system, get them in an infrared sauna. To me, it makes perfect sense, because the body is this beautiful creation that for the most part knows how to heal. Now, we get some things thrown at us, and especially as we get older, we get things thrown at us, and we just have to go with this physiology and go, this will fix. It's like when years ago, I had gone to my, at the time, primary care medical doctor, and did my blood, and he looked at it and he's like, well, I don't know what to do for you. I'm like, well, what do you mean? He goes, well, I don't know what to give you. I said, well, what do you mean? I said, is my blood okay? Is everything good? And he's like, yeah. It was like, that was the problem. Everything was normal.
Oh
and
my
he was
God.
like, I don't know what to do. I said, so I don't need anything, right? He's like, no. I said, so we're good, right? So again, it goes back to this
he's trying
mentality.
to find something.
He's trying to figure out, because his mind is, this is how I can help you, is by giving you a medication. So if I can't help you, if I can't give you a medication, and again, it boils down to our expectations and what we think. I'm actually starting to write a book, just because I see one patient at a time, and I just say a lot of times the same thing over and over. And one of the places I start in the book is very simple. It's like, what's your expectation, right? The expectation is, we get older, we slow down, we get on medication, and we check out. And that's pretty much what most people think aging is, right? Well, what happens if you change that paradigm within your own mind? What happens? You've
got a point there. I see where you're going.
Because as the man thinks in his heart, so is he, right? We have to use this beautiful computer up here and create a blueprint.
Realize we can control that. It doesn't
create a blueprint.
Right.
So what is your blueprint? What if you were to say, you get up in the morning every day and say, I'm healthy, I'm fit, I'm strong, my mind is clean and alert and quick.
Love it.
What happens if I have all the energy I need for every day? And this becomes your expectation through your life. I mean, there is a character in the Bible, his name's Caleb, I think. And I think he was 85, and he says, you know what? I feel as good as I was when I was 40. Let me go take this mountain, kind of thing. Wow. I'm like, dude, you are my hero. And that's, I think, if we change our expectations, a little bit, but it does mean we have to do things a little differently, because if we all keep doing the same thing over and over and over and over again, we know we're going to get the same result. We can't expect differently. So what happens if I drink more water? What happens if I do you know only 23% of Americans get the minimum required amount of exercise? Okay, minimum is only 150 minutes a week. Okay, that's minimum. That's minimum, only 23%. And there's pretty much nothing that exercise can't help, So let's start with a different shift in our paradigm, right? Does it have to be, and I'm not anti-medication. So I want to clarify that, because there are patients who absolutely need certain medications.
Yeah, of course, 100%.
And my favorite kind of patient is the alive kind, but what happens if, what happens if we were to go, you know what, I'm gonna change my diet. I had a patient came in, his glucose was 389, I think, off the charts, hemoglobin A1C off the charts. And I just looked at him, I said, okay, you just need to tell me right now if you're going to do what I tell you to do. And he goes, well, you can kick me out. I said, no, but my favorite kind of patient's the alive kind, and I want you to stay in that category. He goes, no, I'm going to do it. And in a month, with all the things I recommended, he did lose a bunch of weight. And he literally, his glucose dropped from 389 to 120 in 1 month. By the next month, everything was normalized, and it's just, so what if we change our paradigm?
Well,
The
starting
paradigm,
here.
right? The paradigm, do we, oh my God, I have diabetes, my mom had diabetes, therefore I have to take XYZ medication, I'm just destined for it. Well, yeah, if you believe that, but at some point we have to go, all right, do I want to stick with the paradigm of I get older, I gain weight, I get tired, I take meds and check out?
Well, I agree with you 100%. And it's interesting what you're saying is a lot of people just think it's positive thinking, but it's not. If we're told something, like if we're told the grass is green,
mm-hmm.
our brain says the grass is green, and so he thinks nothing of it. He puts it in the computer, and then all of a sudden, when someone tells us the grass isn't green, we get kind of frustrated because we've been taught a certain way.
Right.
We've been trained. Literally, think about it with work. You go to your box car, to your box office, to your box computer, to your box phone. Everything's a box. I mean, what the heck? I'm going to end up in a box? That sounds
true.
Great. And so we do these things and not realizing that we have been trained. When the bell rings, okay, you can go to recess, you can go on a break, you can go to lunch break. So we've been trained very little into our adulthood. And what I've learned is that the brain, when you think something and you start to do something, a new activity, that brain, like an almond, it creates a new wave length inside the brain.
Yeah.
But the cool part about it is this, before I go to the cool part, the sad part is we have this brain, and we start to mold to a certain thinking process. Oh, you're going to live between 50 to 75 if you're right. Now, I'll be straight with you. I've told my brain you're going to live to 160. See, I'm not going to go with the mold. I'm going to go against the flow. Right. And if you start thinking, oh, I'm sick, and oh yeah, you're never going to heal, and you start telling your body that you're never going to heal.
Oh, sure. How many times do you hear people who say, oh, if there's a flu, I'm going to get it. If there's a flu, I'm going to get it.
Just
and then they get it, and they're like, see?
I told you. I know.
But, and if you think about it for a minute, think about this. See it, believe it, it happens, right? So, and we do this all the time. We don't realize it. And I'm going to use my home as an example, right? We bought this land, and there was land, right? There it was. And we had this idea of this house. Okay. So that was something in our mind, right? So we saw it, we believed we could do it. We worked with somebody, we tweaked it. And now there's this beautiful home on this land that came out of here, and we see, we can understand that, right? But what if we take that concept and we apply that to our health? I mean,
I agree.
I have a friend of mine. He's a doctor, and he was out bike riding. He was hit by a car, and his back was fractured, and he wasn't able to walk, and the doctors wanted to fuse his spine. He really didn't want his spine fused. He had enough knowledge of different things and access to things like laser and so forth. And he would just lay in the bed, and he would visualize himself getting up and walking, visualize himself, visualizing all the tissue healing perfectly in the way it needs to heal. Long story short, he's up and he's walking and he's working, and those kind of stories are just miraculous, but I still believe that miracles happen, because see, I get to see them every day. So I'm like a little kid in that way.
But see, and I agree with 100%. And it's so funny. My wife, she says this to me all the time, and I'm getting better, but like, I'll say something, she'll be like, speak life.
Yes.
She's always on me, dude. I love it. And so I'm with my kids. I go, speak life. I go, if you're giving up, you might as well just forget about it and stay home because you've given up. I go, if you tell yourself, your computer, oh, I can't do it, and you're not going to, like what you said, what a man thinks is what he becomes. And it's very interesting when you look at the determined and the non-determined, and it goes with everything in your life. I don't care whether it's from health to success to whatever you're doing.
Right.
You know what I mean? What keeps us alive, and this is just my thing, is it's this energy. And you've got good energy, you got bad energy. And then you can have tired energy too, and it's so interesting how they did an actual study on, they cut up an avocado and they put it in a jar, one in one jar and one in the other jar. They just split it in half, and they put one in another room, and one person was speaking bad things about the avocado. I hate you. I don't like you. I wish you were never born. Like they were just
avocados,
saying,
that's hard.
but that's half of, yeah, but that's just that other half. But the other half of the avocado, they had classical music going on in the background. I love you. You're appreciated. I'm so glad you're alive. Speaking life. They did that for 5 days straight. And then when it came back and they brought them back together, the one that was spoken bad was all moldy and dirty looking and just dying. It was dead. And the other one, it stayed vibrant.
Wow, that's so cool.
And it's so true. You can even do it with an apple. It's very interesting. And it's like that with our bodies. So, if your back is, let's say you were saying something about your back, start speaking life. Yes, you're doing everything to get your back on track. Right. But at the same time, I speak life on my body. You are healing. You are getting stronger.
Right.
Opposite of everything else, because we deal with enough negativity. And that's why, going back to, IV therapy, I think it's very good. I look at IV therapy from just gathering with what you're saying and stuff that I've done research is, it's kind of like a car. You can have that car. Let's say you buy a 1966 Mustang, you're taking care of it. And, 25, 30 years later, it's not running as the way it used to.
Right.
And then you go back and you go to the doctor, the car doctor, and he says, you just got to change the spark plugs. So in a way, you're changing the spark plugs. You're bringing a spark back. Right. Just because you're getting a little older doesn't mean you have to act.
Oh, no. I mean, no, absolutely not. We have some patients here. They're so cute. They're older. They're in their later 80s, and they come in and do neurofeedback together because they want to keep their brains sharp. And they come in and do IVs, and they want to, and they have so much energy. And they're always laughing and enjoying their life. And it's just so beautiful to see, but you do have to take care of this.
Yes.
Right? It's like, and
you only got one.
Right. I mean, we know how to take care of our cars. We know how to take care of our, our houses and things in our homes, but a lot of times we don't know how to take care of this. The human body is interesting. We think we can eat anything because we don't die from eating a fast food something, but it doesn't mean we're getting that. We don't die right away. The body's trying to figure out how to make it work, even though it's not getting all the ingredients it needs, so to speak. And that's when we start to see breakdown as we get older. You bounce a little better when you're younger, You
do, and it's interesting that you say that. It just kind of came to me right now, is that people need to know that they're worth it. See. People want to put it's so funny. They're so quick to buy the new iPhone or the new phone, and they'll spend $1,500 on that, right? But I can't. But I'm not going to put $1,500 or $2,000 on my health. Let's wait for it because it's not insured. Right. That's crazy.
It is.
I mean, it's like it's worth it. I mean, I went to the doctor, like I was telling you. And he spent 5 hours on my body. I've never had any doctor do that. Right. And it was kind of weird because I'm used to just going in and going out within 15 minutes, and I got some pills and I'm good to go. This case, it was different, Yeah, I got a discount. I mean, I don't know. I think I spent like $2,000 or something like that, or $2,500. But let me tell you something. It was the best $2,500 that I ever spent in my life, because I do not have that problem anymore. That I was having for 25 years. And it was very painful. My body was in pain. I told you the situation. I was sick all the time. Right. I no longer, but I tell you what, when I went to I call it the institutional doctors, they were just kept giving me these pills that were affecting certain parts of my brain, my thinking, my process, my liver. And I'm like, I can't do this anymore. I'm not going to. Right. Well, and I think sometimes sometimes people feel bad and they don't know it because they haven't felt good in so long. They don't even know. They don't even know what it feels like to have energy, to feel good, to have a brain that's clear, to sleep well, to, move without pain,
to, I mean, these bodies were meant to last us a really long time.
Yes. Oh yeah.
And to me, it's, my functional medicine patients, as they come in as new patients, they're getting younger and younger. It used to be my typical functional medicine new patient was typically female over 50 post-menopause, right? Because after menopause, everything changes.
Right.
And now I think the average age is probably 32, maybe.
Wow.
32. Fatigue. And what's really sad is when I ask them, so when was the last time you felt good? Or I talk about something like, oh, as long as I can remember, I've had this problem. I'm like, since you were like a fetus, and
You're
they're
wow,
like, yeah,
we got a lot to work on.
Pretty much. And so it's like, oh my goodness. We have young people growing up, and I see it in our neurofeedback department. We get a lot of kids there with ADD, ADHD, anxiety, depression. It's really hard for my heart to see a 7-year-old on an antidepressant medication. It's like, it's 7. I mean, you should be a giggle going somewhere to happen.
Yeah. Eating a bag of hot Cheetos or something.
Right. So again, what's the problem? What do we have to address so that this kid can go live her life? But going back to what I was saying is, I think some folks have not felt healthy. They've not felt good. They don't even know what it's like to feel good. So that's where you have an imagination. Use that. Use that, put some kind of, get a superhero in your brain and, in your own mind, be that superhero. But,
you're right.
It's just, we have to start somewhere.
Yeah.
Right. So we have to give ourselves where do we want to go? What do we want? Right. And then
purpose
and purpose. Right. And then we have to go, okay, well, what have I been doing? Is this working? Then maybe we need to do something different, and start going for there. But everybody has a purpose on this planet.
I love it. I love where you're going.
So we need to, I'll give talks out at my church periodically. And the reason I do is because my thought is, if the church is not healthy, she can't do her job.
Yep.
If you're not healthy, you can't do what you're put here to do. It's just that simple, because you don't feel good. You're laying in bed, sucking your thumb. It's like, we should all wake up, have energy, feel good, be positive, eat healthy, exercise, move, drink water. It's not that complex. I spend most of my time teaching people how to just be human. And that's, once they get back to their humanity and how we were created to live, what we were created to eat, how we were created to exist, they just have this beautiful, they're like a rose and they just bloom, and I've had patients come in just with smiles saying, oh, Dr. O'Keefe, I won't eat like that again. I feel so good. You've given me my life back. I'm like, I haven't done it. Yeah. You really did the work. I just kind of turned you in the right direction, But
I think you're hitting it all on the spot. And I like where you're going, because it's so true. And I think the word that keeps popping is identity. When you don't know your identity, and this has everything to do with functional medicine, I believe, because number one, it starts up here. Because you have so many people like, that's not going to work. Well, it's not going to work because you're already damning it.
Not work. Right.
And you're joining the grumpy club. Right. And so, I love that scripture where it says, my people lack because of knowledge.
People perish for lack of knowledge.
Lack of knowledge,
and exactly. Yeah.
And that's so true. And it's funny. I was talking to my wife just a few days ago. So cool. So it kind of goes with what we're saying. I was like, I've been spending time with God. And one thing I've been learning, is that I'm not dreaming big enough. And God wants us to have fun. And let's go dream. Like, we're talking about our home, we got a really big home and everything. I was like, we were talking of ideas and everything. And then something popped in my head and I'm like, let's pretend we have no money issues. Let's pretend that it's unlimited. And she's like, okay, where are you going with this? I go, I'll tell you what I would do with this house if we weren't on a budget. And I go, let's talk about what we would do. And then as we started, it was like really big things, especially on my head. Cool. And the next thing her, and then I looked at her, I go, we're going to do it. She's like, what? I go, we're going to do it. So my point is that we and it's good to write your goals
Oh yeah.
Your health goals, your success goals, everything, because they go together. You cannot separate them.
No, and it's so important to write things down, because half the time, and I keep copious notes with my patients, and I'll go back and I'll say, well, what about this symptom and this symptom? And they're like, oh, I didn't have that. I went, oh, you did, but you did when we started. Oh, you might be right. Because when we get healthier, it is truly our natural state. And that is our normal state. And it's like, oh yeah, oh, I did have that problem, didn't I? Because now we've been dropping this symptom and that symptom and this symptom off. And now we don't have fatigue, and now we don't have constipation, and now we don't have anxiety. And now oh, you're right. That's right. I did used to have acne or a breakout on my arm or whatever, and it's like, so there is so it's important to write down, of course, where we are coming from, but where we want to go, and again, I guess we're just jumping into scripture a lot today, but there is a scripture that says, make it plain upon the tables so that he who reads it can run with it. So we need to write it down, and we need to envision, where we want to be, and
not type it out, write it down, because it creates an imprint on the mind.
There is a complete, I'm a big journaler. I love to journal. But it's one of those things that all of that is part of how the human body is going to heal. And we have so many things at our disposal now, that we didn't used to have years ago. It's pretty easy to come get an IV. And it's very relaxing, I mean, you just kind of like chill.
It's pretty easy.
It's pretty easy to go sit there and have somebody literally do UV blood therapy and boost your immune system. It's pretty easy, if you think about it, to drink water. It's pretty easy actually to come in and do neurofeedback. We basically put glasses on, we monitor the brain waves in the brain, and as you watch a movie, the software works with your brain to help retrain it. So if you're having problems with insomnia, that can get trained out. If you're having troubles with anxiety and depression, that can get trained out. So there's just because we're creatures of habit, right? We can train our brain just like we train anything else. If I do enough bicep curls, I'll get a bigger muscle, right? If I keep telling myself over and over and over again, I'm anxious, I'm anxious, I'm anxious, that's just me, we've created a pattern in the brain, and neurofeedback can actually help change that pattern.
I love neurofeedback. I remember when I first tried it, I was, stressing a lot over some family issues, and I put these glasses on, and they kind of look like Terminator glasses at first.
Yeah, it's pretty cool, actually.
All right, I'm all wearing them, and then all of a sudden I'm like, oh my goodness, I feel so relaxed. Like it's like, it almost like somebody just took it off the backpack off of me. And I was just so relaxed and just so happy. And I'm like, wow.
Yeah. I mean, the first time I did neurofeedback, I got up and I was like, whoa, look at all the colors. And then I started, and then the next time I'm like, look at all the detail.
The detail.
And it's like the brain is working properly. It's working the way it was created to work. And therefore I didn't have to work so hard.
It's like a computer when you do clear the cache,
Yeah. It's just,
yes.
Oh my gosh. Yeah. I think we had, I have one of those little portable units. So sometimes I'll sit in my office and I'll put the Terminator glasses on, and I'll be, while I'm working, I'll be doing my brain training, and my front desk person comes in one time, she goes, oh my God, this is perfect. Well, next thing I know, I'm on TikTok, and I was like,
oh my, I love it.
Oh, great.
You should do that with a Terminator beat. Dun, dun.
Oh, yeah.
And then you do a voiceover.
Oh, yeah.
Because you can do the voiceover. I'll show you I can show you how to do that. I do TikTok anyways, but actually that's a good idea.
Yeah.
That's a great idea. Actually, I'll do it. I'll send it to you, and then I can show you how to do it. It's so fun and easy, but I know we're anyways.
Okay, now we're just going.
Hey, so. You and I, we're just going.
We're just going.
But,
all right.
It's always a pleasure to have you on the show, and you and I are just like two peas in a pod, and we just can go for hours.
We can talk for hours.
We're like, forget about the time limit, but thank you so much for being here on the show.
Yeah,
and
my pleasure.
Everyone, I want everybody to realize, Dr. O'Keefe, we named off a few things that they do in their office. We do IV nutritional therapy. We do ultraviolet blood therapy. They do neurofeedback. They do a lot of stuff to focus on helping heal the body and heal the mind. And that's the most important thing that we have is our mind. So if you're struggling with right now from post-COVID, whatever that whole thing happened in the past 2 years, a lot of people are. And I know that I struggled a lot with that when I first had my COVID experience, which was very interesting. And the brain fog was unbelievable. I had like little essence try to come here and there. But let me tell you guys something. If you're looking to get unfogged, unstressed, you guys are going to want to go to restoringhealth.center, restoringhealth.center. You can also find them on Facebook. Go to their website, their Facebook, their instant message. I mean, everything's on there. You can call, give them a phone call. And again, thank you so much for being on the show.
Oh, my pleasure.